Dr. Eric Feigl-Ding, he is a public health scientist from Harvard University. Thanks so much for being with us. You know, while some other countries seem to be choosing somewhat carefully who gets a coronavirus test, China has gone all out in the city of Wuhan. 11 million tests. Is it worth it?
It's very bold, but I do think it is worth it because it would actually tell you, truly tell you, how many people currently have it without selective cherry picking of who you're going to diagnose or testing them too late only among those who are symptomatic. Because we know that there is so many people who are actually asymptomatic carriers. If you're asymptomatic carrier, normally you would never be reached for testing unless you develop something. So they really want to know, can we truly safely reopen, or how eradicated truly is this? And the only way to do that is to test everyone, blanket.
Okay, so as a doctor then, what do you hope and what do you expect to actually, for these 11 million tests to really prove?
I think it'll tell us many things. First of all, what is the actual transmission rates from the remaining cases? Because they will find cases, I guarantee that. How many of them are truly, truly asymptomatic, and how many of them never any of these asymptomatic won't ever develop symptoms whatsoever? Because right now we don't really have a true grasp of how many of these silent carriers are truly floating around. And if they know the number is low enough, then they can know that we can safely return to business as usual. But until then, it is a very risky proposition. And, you know, instead of just sampling here and there, by doing it for everyone, they will actually get to the heart of the matter of how many people have it and answer these critical questions.
I might border on sounding naive with this question, but I'm going to ask it anyway. Is there any chance with all this testing that this virus might prove not to be as dangerous as many had feared, that maybe it actually isn't mutating or won't mutate as badly as some are expecting, that there might even be this notion of herd immunity by now? In other words, is there means for optimism?
There is means for optimism, and for herd immunity, you want to see how many people have truly have had it, not just at the current time, but in time in the past. And those are best done by antibody testing, which China is also doing in Wuhan. But I highly, highly doubt the herd immunity will be reached, because you need, for the virus as infectious as it is, you need 75 to 80% of the people at minimum to have it in the past. And that is a strategy of basically, let's risk 3 or 4 people's lives in order to save the remaining 1. That is not a strategy. And we know from Spain, France, and even Sweden that their antibody prevalence of people exposed is well under 10%.
Okay.
And these are really hard-hit countries. And you don't want them to have, you know,
right,
like at least 10, if not 12-fold higher epidemic than they have just for herd immunity.
Very, very quickly,
So
how much would you want to see a city like New York do this kind of testing?
New York has done it, and New York is, it's around the teens in terms of antibody testing. New York has not done blanket PCR testing. And the blanket PCR testing for the direct virus, which tells you right now, do you have the virus, as opposed to antibody, have you had the virus in the past? I think it's, to do the PCR testing, it is a lot of labor, and China definitely is bulling the grunt work. I think what we learn from this Wuhan 10-day blitz will actually inform the world of how bad and difficult it is to contain all the asymptomatic cases.
Okay, Dr.
But we know that
Feigl-Ding
New York has had about 50% in the city of New York.
Right. We're going to have to leave it there, unfortunately. Thank you so much for joining us. We really appreciate it. That is a wrap for this NewsHour. Do stay